Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre. I would like to introduce to the program Kenny Owens from Houston, Texas. Thank you for joining us.
Thank you, Kimberly. I'm glad to be here.
Kenny, I met you in person when you were in town for your Bonati spine procedures. So again, thank you for sharing your story of recovery. But why don't you tell us how you came to be in pain?
Well, when I was 21 years old, I was doing squats and I herniated a disc, and I had on again, off again crippling back pain for 15 years. And I got pretty decrepit, and I finally got so crippled down that I could barely work.
Where were you feeling pain on your body, and how was it impacting your activities?
Well, basically, it was L5S1, and sure enough, Dr. Bonati showed me on the MRI how it was causing the problem. So, yeah, it meant that I was unable to work, and it was very problematic.
Did it affect you walking or strength if you were trying to climb stairs? I'm just trying to get you to elaborate, so if people are watching or listening, they can kind of see themselves if they're suffering in the same way that you did.
Well, I think perhaps my situation was, as long as I got worked on 8 to 10 times a month, I could at least function. But once it started flaring up, I was totally disabled and nobody could even work on me.
Why did you wait so long to seek treatment?
Well, because for 20 years, I got worked on 5 days a week, and I never had pain. I ran 2 marathons. It wasn't until I quit having the treatment on my back that it could put enough compression on the bones, compression on the disc and the nerve, that finally it was just too much, and I couldn't bear it.
So you said that you watched Newsmax, you saw the program, and then you went to YouTube to check out all the Bonati Spine Institute videos, and then you made your decision to come in. So why don't you kind of walk us through that process? What was it like to call for an evaluation, a preliminary evaluation over the phone, and then when you were physically face-to-face with the doctor during the evaluation?
Well, it went very smooth. I called the phone number, and my advocate, she was very pleasant, very helpful. Dr. Bonati called me, and another doctor called me, talked to me about my situation. So when I went to the Bonati Spine Institute, it was just a beautiful place. I went in, and they had me fill out the paperwork. It was a very smooth process. Then I went over to get imaging. I was in for surgery the next day after. I was very surprised how well oiled the machine was, how everybody did such a professional job, how nice they were, how orderly everything went.
With the Bonati spine procedures, they use something called conscious IV sedation. So you're not put completely under, and you're interacting with the surgeon during the procedure. You are afforded a chance to watch your procedure and invite a loved one in with you. So why don't you explain what that experience was like for you?
Yes, I had a friend that came with me named Lisa, and she wanted to come in and see what was going to go on. Yep. And I knew from watching the videos and hearing the testimonials on American Medicine Today that I would have the opportunity, should I be conscious enough, to watch the videos. And sure enough, I could see what was going on, and my friend was kind of eagerly watching, and it was an amazing thing to see. Of course, I couldn't really tell exactly what was happening because there was a little bit of blood and some tools in the way, but it was still an amazing thing to see. Dr. Bonati, such a skilled technician.
Yes.
What
was that experience like? Even if you saw some blood and there were tools there, did it almost take you out of the moment and kind of alleviate any anxiety because you could actually see and hear and communicate?
Well, I didn't really have too much anxiety because I totally trusted Dr. Bonati. He was so warm and helpful when he's explaining to me what he wanted to do.
Yes.
I felt totally just surrendered to him and his competence. And I had no anxiety. I was comfortable. It was actually joyful, I would say.
What was recovery like? Because obviously you have the small incisions, so you have that, but we're not talking about that pain. The agonizing pain that you felt, when did you feel it lift?
Well, I'd say from the moment of the surgery. Yes.
Lift the leg up.
Lift the leg up, Ken. Straight.
All the way.
All the way.
All in there. No pain here.
No pain anywhere.
No pain here.
No pain anywhere.
No pain in the butt.
No pain anywhere.
No pain here.
No pain anywhere.
Good, man. Beautiful. All right. Congratulations.
As soon as I was in recovery, I noticed there was something that was freed up in my back. And as days went on and I could move around and twist around, I knew that something was different. So the first time I went running, now keep in mind before, if I would run 5 minutes, I would be so crippled I couldn't work for days and days. Wow. So in this case, I just cautiously jogged slowly. Everything went fine, and I kept repeating and repeating. Finally went to Memorial Park, which is the local place, 3.2 miles, ran around that. So I'm back. I'm so excited. I can't say enough good things about Dr. Bonati and his unique procedure.
If I can put you back in the recovery area, they get you up and walking immediately after surgery. What were those first steps like?
Well, I would say it was just a pleasant surprise. I wasn't totally surprised because I watched so many videos.
Yes.
It was kind of just as expected, and a great joy to know that something had been done that's going to, I'm still in the youth of old age, and I got a lot of years ahead of me, and I wanted to make sure that, I wanted to get this taken care of while I had the chance. And then I went back to work in 5 days, no pain. I've been running again, and I can't express my gratitude.
Before they released you from the Bonati Spine Institute, were you told to wear any sort of brace?
Actually, I didn't have to wear any brace. My procedure went so well. I had no pain. It was amazing. I just remember, going over and thanking Dr. Bonati and asking when can I go back to work. He said, as soon as you want. And I was kind of surprised, but on the day 5, I went back to work, and then I've never, I haven't looked back.
Fantastic. And it shouldn't be a surprise because we don't tell people to wear braces. So once you're up and walking and ambulating and you've regained your strength and gotten back in motion, that is that healing process. So thank you for sharing your story of recovery with us.
And thank you for having American Medicine Day. It changed my life.
Thank you, Kenny. That's Kenny Owens from Houston, Texas. Thank you for your miraculous story of recovery. Now, if you or anyone you know is suffering just like Kenny, you can head over to the Bonati Spine Institute on YouTube. And if you want to find out if you're a candidate, visit askbonati.com. Stay tuned. We'll have more after the break.